I'm still at the ADAS thing, and I'm at the next session, and Ali's going to be my cameraman. She's going to hold the camera for me because I want to introduce her. This person I'm introducing you to, I should be bowing really before I introduce him. Yeah, no, I should be bowing because he's a god, right? This is Art with the unpronounceable surname, which is
Art.
What's your surname? The next
Leefrink.
Leefrink. Art Leefrink. Okay, well done. The camera. Don't get cocky. The camera.
His name is on there.
Okay, well you better do it again. Okay. This is Art Leefrink. Now he is from the best company in the world. He's from Buurtzorg. Now everybody who knows what I write about, anybody watching this who knows me will know Buurtzorg. It is the company that's inventing how to look after people in the community. It's teaching the world to look after you, granny, and it's the only company that's reducing the number of knocks on the door. He's preparing for his presentation, which he might just agree that I'll periscope a bit of it just to give you a little taster. But it's a real pleasure to meet you, and thank you for what you've done from grannies everywhere and a few granddads. Thank you for your inspiration and your ideas and innovation.
Well, thank you.
We've got a lot to learn from you. Thank you very much.
Thank
you. Okay? Thank you. We're just going to show you the beginnings of a lecture. Art Leefrink. He's the co-founder of Buurtzorg in the Netherlands. And we'll give you a little flavour of what the Buurtzorg nurses do.
I want to start telling you a little bit about Buurtzorg because I don't think everybody is that familiar with Buurtzorg. I heard some people are real fans. Well, I'm really honored. But I'll talk a little bit about Buurtzorg.
He's talking about me.
Just over there. It's not over here.
That's technology for you.
Yes, then I'm there. Okay. There's no problem.
We're driving on the left.
Well, I'm focusing on the IT part because it was one last journey from me. It started 10 years ago. I was working in a large healthcare provider company with 4,000 or 6,000 people, a lot of management, a lot of staff, and a lot of people thinking how we could make it better. And 10 years ago we started a new organization, and in fact it was based upon earlier experiences with public health in the Netherlands. In the 80s, we had a fairly good infrastructure for public health, but we broke it down in the 90s and we made a real other type of organization, and we just wanted to revitalize that, and then with new technology and new insights. We started in 2007 with one team and 4 nurses, delivering community healthcare. Strictly working and making a lot of connections with GPs and physiotherapists and all kind of first-line workers. But now, 10 years later, we've got 10,000 nurses in approximately all the country, in 850 independent teams. But there's no management involved. There's only one CEO, and it's Jos. He's the head nurse. Jos de Blok, he's always telling all around the world about the skills of the nurses, and I always call him some kind of a nursenizer. He's always in charge of always talking about his Buurtzorg model. We serve about 70,000 patients a year. When we started it, we hadn't got a clue. We didn't have a clue how it became. It wasn't the strategy to grow big or something like that. We just wanted to make a new model around the workers in the field, because there were more and more in the background, and also the organizations where I worked, back office was more important than the primary workers. So we wanted to change that. I'm the only not nurse within Buurtzorg. I'm the one who's responsible for the back offices, processes, and IT, and all the research and development from now on. Well, the model of the situation in Holland in 2006 when we started, it was, I think I heard it, the intros this morning, and I heard it yesterday, and it still is. in Holland it's very fragmented, but it's the same problem as you have here. A lot of fragmentation, cure, care, prevention. There's a lot of standardization in tasks, and there was we're always trying to bring the cheapest person to do the task. So there were a lot of people coming into my granny's home and went back just waiting. I wait for the other one. I saw just 2 or 3 persons waiting to do their task within one single house, and they all 3 were skilled to do all the 3, but they were similar. There were different contracts and different planning and different routing, so they were doing the same thing in the house. But it was also a problem within the demographic, and the costs were getting out of control. So we started this home care organization just around small teams. And I just want to get back on the ICT, because all we did was controlling tasks within time. All the IT and all the organization was also based on these principles. We were always organizing workflow within the systems, time stamps, controlling if the tasks were done, and all those kinds of software. But it doesn't help people and it doesn't help workers. So we were trying to get ICT solve problems only for management and for healthcare systems, not for the nurses and the workers. And the patient in all these solutions was nowhere. It was always about patients, but they were never involved in the IT solutions and in the other discussions. And we also had a very large promise, national architecture, who will solve all the problems in our country. They started to build on that national architecture, I think, 15 years ago, but it still is a very big promise. It's not ready yet. Now, I won't think it will be ever be ready, because internet is going that fast that they will never be ahead of all the developments. Well, self-organization was very important in our model, and also the idea that they can organize their work themselves very good. We make a geographical structure, around 10,000 persons and patients, and they have to organize as a team the total process: planning, scheduling, routing, discussions with family, all kinds of things. They have to do it themselves. They're responsible for the budget, and everything you can imagine. They are doing themselves, without management. And when we started it, everybody said, well, you can do it maybe with 1 team or 2 teams, 3 teams maybe, but now we're 850 teams, and that's not the problem. In fact, it's very strong in our model, because we never have to look after difficult management. Sorry, I have to look for the word sometimes. Struggles, because they manage it themselves, and I didn't expect it that it would work like that when I started it. I had a lot of books, management books. I studied public administration, so I have a lot of background in how to organize large companies, but it wasn't in the book. So it was a real nice journey for me to explore. I was always fighting with systems, fighting with accountants, fighting with lawyers, fighting with all kinds of people in the back office who thought it must be this way, it must be that way, but never, when my opinion is when I can explain to a worker why it's important to write something down, then it's not really important, because they know what to do and they know what to organize, and they want to be accountable and they want to write things down. That's not a problem, but it must be a logical note or a logical thing. And all what we invented in the years before we started with this self-organization point of view. They always had to write down things without explanation why it's important, so we couldn't get them really enthusiastic. Well, this is their own ecosystem, what they have to can organize. We work with this very simple onion model. It starts only with the client and the relationship with the nurse or nurse assistant. It's this relationship what's very, very important. And within this relationship, they've got their colleagues, and that's where they start working. And then they start to make the informal network around this relationship stronger. The daughters, the sons, the neighbors, they all try to involve these persons and peoples within the client's situation. And then when that's not enough, then the team comes in, colleagues, and organize more and more and more. And then we are attracting the formal networks. But it's not the way the system is working, but you're paid for just doing your tasks. And when you're doing more tasks, then you're getting more money. So it's complete against all logical to do it this way within our reimbursement system.